Thank you very much. The presentations have been excellent so far, so I feel a tiny bit of pressure. But I'm Eve, I work with HaemochromatosisUK. The main part of my job is to interview patients and learn about their experiences, what common hurdles they confront. So our app was basically designed to look at those challenges and develop something that would help them manage their own healthcare. Just before I go into it, I'm going to give a little bit of a description of hemochromatosis because I'm imagining most people probably haven't heard of it. It's quite a strange word. It's actually a very common genetic condition. It causes iron to build to toxic levels within the body. So most of us, when we eat, we can absorb iron from food, and the rest that we don't need is removed. With hemochromatosis, there's a genetic mutation that prevents that from happening. So the iron builds to a toxic level in the body and is stored in organs and soft tissues. And if it's not treated, it can cause death. If not, lifelong conditions, diabetes, arthritis, cancers, cardiomyopathy. So that's what this is designed to do, is to help patients better take care of their health. So it's genuine co-design and collaboration to address real unmet patient needs. So we talk to our community all the time. That's what I do. I burden them all the time with questions about how they're finding things. So common things that we confront are, my GP is telling me that my ferritin, that's iron, my ferritin levels are normal, but I can see on my NHS app that they're actually high. What should I do about this? So we have a fantastic helpline team that consists of specialist nurses that can answer calls. So we're constantly in contact with our patients. So the app was delivered on time and on budget, within budget under £20,000. The app provides a platform for further patient advocacy and research. So app usage generates a unique GH, that's genetic hemochromatosis patient registry dataset for clinical research and community advocacy. So that means that from the app we can see how many people are affected, how many people are in need of this help. And Alice, who's our AI chatbot, is available 24/7 for help and advice. So our helpline staff are available weekdays from noon until 3 p.m. Alice is available all around the clock. So why develop an app? So genetic hemochromatosis isn't rare, it's rarely diagnosed. So that's one of the big misconceptions. It's a big, strange word, so it's one of those things that we think just doesn't exist very commonly. It is actually the most common undiagnosed genetic condition in the UK. So as you can see to the right-hand side, in England, 1 in 150 people are at risk. Scotland, 1 in 113 people are at risk. Wales, 1 in 150 people are at risk. And in Northern Ireland, 1 in 10 people are at risk. And next week, we're actually launching a project in Northern Ireland to raise awareness of this condition, a photojournalist collaboration project that we hope we'll be able to exhibit across the UK to raise more awareness. So clinician awareness is generally low of hemochromatosis, so good help is very difficult to find through the NHS. We find that this is commonly reported by our members, that their doctors are telling them something that is counterintuitive to what their results are saying. So that's keeping an eye on serum ferritin levels and transferrin saturation levels. That measures how much iron is stored in the body. So there's no cure, but treatment is very simple and it's effective for most people. That means very regular blood donation, or a process called venesection. And the good thing about that is that venesections are cost effective for the NHS, where conditions that come from hemochromatosis like diabetes, arthritis, are very expensive for the NHS. Despite that, we do find it difficult that some of our members still struggle to get put in for venesections, and there's a lack of sort of preventative health initiative there. So for optimal health with the app, patients need to track their blood results, juggle appointments, manage paperwork and advocate for their care. Again, adopting a kind of on their own head sort of approach to their health. We found that that's what most of our members report having to do. And the demand for the charity's help is doubling annually, so we thought maybe an app could help with that. So this is what it looks like. As you can see, it's personalised. Members can write how they feel on that day. What we're doing at the moment is looking into how we can better mental health support for our members. So you can write how you feel based on how your hemochromatosis is affecting you that day. You can track your next appointment, you can write a journal entry, You can track how many venous sections you've had and how many venous sections it will take for you to be in maintenance. Maintenance is what we call healthy iron levels, so that's after multiple venous sections, iron levels will lower and get a patient into maintenance. So yeah, our app was designed by members of the GH community for the community. We really don't take many steps without confronting our members. They're very much a part of the process. So yeah, it started as ideas and rough sketches, transformed to a clickable prototype within 12 months. And then from a clickable prototype into an app that works on Android and smartphone devices. And this is Alice. This is our AI chatbot. She's available 24/7 on the app and on our website. She's the newest member of Team Iron Overload. Everyone's very excited. Alice is AI, and she's trained by HaemochromatosisUK's helpline team. That consists of our members. What we have is our buddies, people with hemochromatosis that can answer questions for newly diagnosed patients about how to deal with living with that. And we also have a team of fantastic specialist nurses who are available and always extremely busy. So Alice kind of takes that burden away. So she's available 24/7. She's helped over 2,000 patients since the launch in April 2024, and she complements the charity's one-to-one helpline, as I said, with specialist nurses. So she's trained with the charity's clinically approved resources, and she's always learning. So this shows the increased usage of MyIron Plus from July 2023 to July 2024. And these are some quotes from our members who found the app to be useful. So just opened the app and started adding my details, looks fabulous. It will help me understand and help others understand and move forward. So essential app for monitoring your iron overload. The app is incredibly useful for planning treatments, documenting your iron levels and being able to reach out to a qualified professional when needed. Since diagnosis, through the charity that created the app as my GP was useless, I've been able to track my iron levels, keep note of my appointments and get to a manageable level now. Thank you. So one of the big burdens that we find people confront is with their GPs and also consultants at a higher level, from being able to get appropriate treatment, and that's due to just a general lack of clinical awareness of what this condition is and how it can impact your life. And this is a final quote to show that, that we're adapting the app so that it's inclusive as possible. So I'm autistic and that makes phone calls a real challenge for me. I've called up the charity's advice line before and spoke with the nurse who was brilliant, but it's difficult for me to do so. With Alice, I can just quickly fire it up and ask all manner of questions.
Well, hello. My name's Mike. I was fortunate the other day. I contacted the HaemochromatosisUK website and, as they suggested, wrote down some of my worries with the AI nurse, and I thought this is going to be the same as any other AI thing. But no, it was excellent, and it answered all the queries I had in a very, very clever manner. Almost as if it was a human. Anyway, it recommended in the end that I spoke to the nursing practitioner. So I booked an appointment with that and spoke to the nurse on Zoom, and it was brilliant. I recommend it to anybody. What a brilliant service. It put my mind at rest for many reasons with my problems. It also gave me some ideas on how to approach my GP, who hasn't really understood my problems because I've been in maintenance for a long time. They assume that everything's fine, you know, you're no problem. They don't know that even if you're in maintenance, you still get the lethargy, the tiredness, especially the brain fog. My God, and I know I'm nearly 80, but for goodness sake, brain fog doesn't occur instantly like that and then go. Anyway, the nurse was superb and gave me some very good ways of approaching and talking to my GP about some referrals for other things. So, as a charity, thank you so much, HaemochromatosisUK. Brilliant service, very grateful. Thank you very much indeed. Bye.
This is a QR code for you to try it for yourself, but I don't think we have time for that, but time for questions? Thank you very much.
Thank you very much, Eve.